Global threats fill the headlines, but one of the deadliest is almost never discussed. Poor sanitation drives diarrheal disease, the second biggest killer of children under 5. This isn't a small problem. Over 1.5 billion people lack even a basic private toilet. This is not about discomfort. It is a matter of life and death every single year. How deep does this crisis go, and what are the surprisingly simple solutions saving lives? The stakes are clear. Unsafe sanitation causes about 5,000 deaths in young children annually. A hidden catastrophe. And it's not just diarrhea. It's a breeding ground for neglected tropical diseases. First, intestinal worms. Then trachoma, which can lead to blindness, and the parasitic infection schistosomiasis. Even when it doesn't kill, it cripples. Poor sanitation fuels malnutrition, stunting a child's development for life. These factors are not isolated. They weave together into a powerful, self-perpetuating cycle. So we have death, disease, and developmental setbacks. But why is this cycle so hard to break? What is its engine? The engine is a cycle of disease and poverty, fueled by open defecation. It begins with no toilets, forcing people outside. Human waste then contaminates water sources, soil, and food, creating a constant high-risk exposure for the whole community. Contamination leads to illness. Sick children miss school. Sick adults can't work. This deepens poverty, preventing sanitation investment. This cycle seems like a perfect trap. So, how can simple solutions possibly make a difference against a systemic problem? Simple solutions work because they don't try to solve everything at once. They target the weakest points in the transmission chain. We've seen the devastating cycle. Now let's look at the specific tools used to dismantle it, piece by piece. The first line of defense isn't high-tech, it's soap and water. Community-based hand-washing education has a dramatic impact. Simply teaching and enabling hand-washing can cut diarrheal disease rates by up to 40%. It's a top health intervention. The benefits go beyond gut health. One study showed hand-washing cut pneumonia infections in children by over 50% by stopping virus transfer. Individual actions are powerful, but collective change brings the greatest gains. Community-wide programs are most effective. Combine water, sanitation, and hygiene, or WASH. And the results are huge. A 45% drop in diarrhea deaths and a 17% drop in all-cause child mortality. But the impact of poor sanitation goes beyond disease. It is a crisis of dignity, safety, and gender equality. For women and girls, no safe toilet is a barrier to school and work. Many girls drop out. Women risk assault, waiting for darkness. Beyond lost opportunities, there's a direct financial cost. In some slums, people spend a quarter of their income just for water. This individual burden scales up to a massive national problem. Global economic losses from poor sanitation are $223 billion per year. So it's a health crisis, a social crisis, and an economic crisis. With a problem this complex, where's the point of attack? The point of attack is found where the moral case meets a powerful economic truth. We've seen the costs. Now, let's look at the returns. Recall the 500,000 children lost each year? That endless poverty cycle? What if the solution was also a top economic investment? This is how simple solutions break the cycle. For every dollar put into sanitation, the return is $5.50 in lower health costs and higher productivity. This isn't just a number. It means girls stay in school, parents earn steady incomes, and children grow up healthy. It's an investment in people. So, is sanitation a secret global killer? Absolutely. But it's a killer with a known weakness. Proven, cost-effective solutions. And the solutions are improving. Decentralized treatment and waste-to-energy systems are making sanitation more accessible and sustainable. The evidence is overwhelming. Addressing sanitation is about unlocking human potential, boosting economies, and saving millions of lives. The path forward is clear. It requires political will, smart investment, and global awareness. It's time to expose this secret killer.